Welcome to Empowered. I'm Elizabeth Naumovski. Our teeth are important to us. Not only do they help us eat and start the digestive process, they mold our speech, give us our facial profiles, and our beautiful smiles. Now, what we don't think about is how stress plays a role in the health of our mouths, that some oral conditions are actually linked to hormonal changes, and how much your mouth affects the health of your body. Today, I'm joined by Dr. Willa Chu. She's a dentist at the Concourse Dental Centre in Toronto. Today's focus is unique dental concerns for women, meaning a healthy mouth equals a healthy body. Dr. Chu, welcome to Empowered. Thank you so much for being here today.
Thank you for your invitation. Looking forward to it.
I am too. And I have to say, in the olden days, I remember my mom telling me that, nobody really wanted to go to the dentist. They came over from Yugoslavia at the time. And, when you went to the dentist, they would yank your teeth. Why do people avoid dentists and dental work?
I think personally, from stories like that there's a lot of pain involved. Number one, because back home, they didn't have a lot of anesthetics. I think the pain factor is a huge thing. And people don't usually come to see us unless they're in pain, which makes the procedure harder because we're trying to get them out of pain, but we cause discomfort in doing so. I think for a lot of us in the economy that we have now, if you're not on a dental insurance plan, the price is a problem. But now with the government plan, hopefully a lot of patients will now see, patients that are eligible will see that there is help for them, especially the seniors that find it really difficult. The other thing I think is the perspective of dentists. There's a lot of media out there that just make fun of us. We want to have the fancy cars, the fancy homes. So it's more of a business as opposed to healthcare. And I think we need to change that perspective for patients, right? That it's important more than you think. I mean, it is healthcare first and above anything else. So we have to take care of the body.
So let's talk about the functions of our teeth. I mean, we all see them when we smile, but what are the real functions?
Well, teeth serve, number one, the smile is a big factor. A lot of studies have shown that people that don't have good smiles, they don't show confidence. They don't go out and create opportunities. They're very shy. They're very withdrawn. So smiling is a big factor. Number two, the teeth help with your speech. If you remember when you were little and you lost your front teeth, you couldn't really talk very well, right? Because you have a lisp. So it does help with speech and phonetics. Teeth also help you break down your food. So that starts the digestive process. So if you're swallowing chunks of food, which a lot of seniors may do because they have dentures and they can't chew their food, you're not going to absorb the nutrients very well. So from that perspective, teeth are vital to help just break down food into manageable portions for your digestive system. The other thing is a lot of people that don't have teeth, they realize their face kind of gets this sunken in look. And it affects just the way you look, right? So some patients with dentures, when they take the dentures out, they're very embarrassed by how they look. So they don't take their dentures out, which then cause other problems. So teeth are more than just, things that look good on TV.
So let's talk about the three most common human afflictions.
So it's interesting that number one, common cold, because across the world, everybody gets a cold. And across the world, everybody gets cavities. And the last thing is, across the world, everybody gets gum disease. So number two and number three, the cavities and gum disease are the dentist's territory. So because, number two and three of those afflictions, people should go see a dentist because we're the ones that will help you with that.
So before we go to break, I want to talk about plaque. Why do we need to clean it off? And what is tartar? And what's the big deal with it? Why do we get it?
So if you think of plaque, it's a moving mass of bacteria. So they say that there's over 100 million bacteria in a little clump of plaque. And in there's about 500 different species of bacteria. So when you see plaque in your mouth, it is just multiples of colonies and colonies of bacteria. So it's like seeing ants on a sidewalk. You see one ant and another ant, and then soon you see this big moving brown mass. So when plaque stays on your teeth long enough, it is actually microscopically a moving mass of bacteria. So when you think about that, at the end of the day, after you've been eating and feeding this mass of bacteria, the food and the bacteria create this fuzzy material on your teeth.
Dr. Chu,
And
hold on to that fuzzy material in your teeth. We'll be right back with more plaque talk. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's focus is unique dental concerns for women. Basically, a healthy mouth equals a healthy body. Dr. Chu, before we went to break, we were talking about plaque. So please continue.
so plaque, I was saying, is like a moving carpet. And the bacteria in the plaque basically can cause cavities and cause gum disease. So a lot of times dentists will tell patients to get rid of plaque because we don't want you to have inflammation or the body's response to this bacterial invasion in your body. Inflammation in the body is not good. Doesn't matter where it is, we need to get rid of it.
So you've mentioned cavities quite a few times now. How do they form? And how does flossing, brushing prevent cavities?
Okay, so the 100 million bacteria in plaque, they will feed on the sugars you feed it and produce an acid. Acid dissolves the outside material of your teeth, which is crystals. So think of it as a house. We're taking the bricks one at a time. You get to the drywall, and the drywall is much faster to break through. So that's what a cavity is. That bacteria just break through the brick wall, then they break through the drywall and cause a hole or a cavity in your tooth. So getting rid of plaque, basically, you're taking away the bacteria that is the culprit. You can't have holes in your teeth if you don't have any bacteria causing the holes. So plaque removal every day is extremely important.
Okay, so let's talk about nature. What has nature given us to help us fend off cavities?
So the beauty of it is your mouth is full of saliva. Saliva is your body defense. So saliva is like nature's mouthwash, but much better than the mouthwashes that you buy at the store. So it contains minerals that will break down plaque. They'll help you just flush out food from getting stuck to your teeth. It'll help you just clear away the bacteria, break down your food. So it's really important to have saliva. Some people that have a dry mouth lack that salivary flow, which creates a lot of issues because they don't have help to break down all these bacteria to get food moving. So their mouth tends to have more infections and inflammation.
So what then, if we're talking about saliva, what hampers saliva from doing its work?
So a lot of things like smoking, using social drugs, medications can create dry mouth because it lowers the amount of saliva flow. There's a lot of people that they have medications puffers. They can just change the oral environment so that saliva doesn't work as well. So there's a lot of things that we do to our mouths, we do to our bodies that can decrease salivary flow, creating issues that we just mentioned.
So is that why we get dry mouth from using all of those vices that you had just described?
Exactly. So some patients with medications, especially for antidepressants, or there's actually a lot of medications that can cause dry mouth. So if you're on a medication and you tend to have a mouth that's very pasty, or you're constantly thirsty, you need to speak to your doctor to adjust medications. Other things is alcohol. Alcohol will dry your mouth. So if you enjoy a lot of drinks, you have to be careful. Caffeine is a big thing that dries your mouth. So if you drink a lot of coffee, you drink a lot of tea, you need to replenish and make sure your mouth doesn't dry out as well. So foods, chemicals, smoking, cigarettes, social drugs, all that can hamper and create a dry mouth.
Interesting. So let's talk about female hormones. How do they affect the mouth? Are there many stages of hormonal changes in a woman's life? And what happens in each stage? In each stage?
Okay, so females have this wonderful thing called hormones, right? So we hit puberty and our gums start to get puffy, they bleed. And it's also the time that we all get braces on. Teenagers have tons of braces, and we know teenagers love to brush their teeth, and they've got braces and they're going through puberty. So their whole mouth becomes a mess. So the hormones basically create a situation where a little bit of plaque before you have this hormonal drive now with the hormones becomes a huge factor where it wasn't before. So as you go through life as a woman and you have all those hormonal cycles, a little bit of plaque before your period can become a big deal during your period or after your period. As you go through young adulthood, there's a lot of other issues that come up, whether it's eating disorders or you start using the pill. that can also affect the gums. Later on in life, as you become pregnant or your hormones become, as you get older, your hormones change, hormone replacement therapy, everything just adjusts the hormones. And it's almost like a tidal wave of messes, one after another. And it's the whole thing of how does the plaque respond to the hormonal changes? And how does the body respond to the plaque? So it's much more sensitive for women during the hormonal changes. So you have to actually pay more attention to your mouth if it bleeds a little bit more than ignoring it because it's bleeding.
Okay, so when we come back, we're going to talk about more oral conditions like hormones and dental health. So don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's focus is unique dental concerns for women. Basically, a healthy mouth equals a healthy body. So, Dr. Chu, what are some oral conditions linked to hormones and dental health, especially focusing on women?
So I think it's not just one or two hormonal conditions. I think it's overall, our bodies are constantly bathed with hormonal changes. So, as we mentioned, as you grow up as a woman, your body is changing constantly. So, and young people, when they start using the birth control pill, it just, you're navigating a different world. Some women with endometriosis or fibrosis in their system, they're on hormonal therapy. So the hormones the doctors are trying to balance, but for dentists, it creates an issue because inflammation becomes uh, it becomes much more important for these particular patients to maintain their mouth. As you go into menopause, as everyone knows, menopause just becomes an issue with burning mouth. You can get dry mouth. You can get a very sort of sensitive gums. If you have dry mouth at nighttime, you can cause inflammation because the tissues are dry. You're much more prone to infections. You're much more prone to cavities because food sticks around your teeth more. So hormones in general just play havoc in the mouth for women. So it's much more important for women to see dentists to regularly check their mouth, especially if they change the medications. If they're on osteoporosis medications, the bone medications can affect any surgical procedures in the mouth. You can have a high risk of what they call osteoradial necrosis, which is bone infection after taking a tooth out, unless you tell the practitioner that you're on osteoporosis medications. So those are quite important because the infections can get quite severe. In terms of other conditions for women, bulimia, people that are anorexic, they create a lot of damage on their teeth because of the acidity and what they're doing. People that are on diets constantly, they fail to get enough nutrients to help fight off infection. And they also lack certain vitamins that will help with healing process. So there's a lot of factors that go into health for women, especially. And I think it's really important that women speak to their dentist and discuss their personal situation with them.
You know, this is such a wealth of knowledge, and now I'm going to take it to the next level because everyone is stressed nowadays. So we're going from
Mhm.
hormones to stress. How does stress play a role in the health of your mouth?
So stress in general creates a lot of problems in the body. So stress can cause high blood pressure. It can cause pulses to race. It can cause cortisol levels, which is something in your body that your body produces, and it just puts your body on a very sort of high strung fight or flight response. And what that does is it decreases your body's natural systems to fight off infection. So in the mouth, for example, a lot of people hold tension in their head and neck and shoulder areas, which then goes to your jaw muscles. And a lot of people will clench when they sleep. And clenching creates hard pressure on the teeth, can cause fractures inside in your teeth. Sometimes it causes microfractures that we can't see until you come in and say, oh, when I chew on my tooth, oh, kind of hurts and I can't bite down hard. And by that time, it's actually a little bit too late because the crack line has already been in the tooth. Your tooth might not split apart, but there's been injury already. So stress in that form, you should definitely get in a protective appliance, which we normally call a night guard, to help prevent damage to the teeth. We can't stop you from clenching, but we're just protecting our environment, which is the teeth, and we're protecting you from losing a tooth. So stress creates that type of response in the body, and the clenching and compression on your teeth can also cause bone loss. So you really need bone to keep your teeth in your head. They might look great on a mantelpiece, but they're not worth anything there. So you have to keep the teeth in the head in an area where the foundation is strong. So you don't want to lose bone. So a combination of bone loss from that compression, and probably if you're stressed, you're not taking care of your teeth, you're not brushing, you're not flossing, creates more bone loss. So everything just escalates from there. So just to manage stress basically just helps the body just calm down. And actually send a lot of my patients to the massage therapists because they're great at decreasing your muscle strain and the stress for the mouth. You can also get other issues like canker sores, cold sores. That's just your body telling you that your body's not healthy and you need to rest.
Just listening to you right now, somebody will say, I have a sore tooth, but it is an incredible domino effect that, you're clenching your teeth, then you have a fracture, then you do this and you do that. And we really, really do need to take care of our teeth because once we lose them, we can't bring them back. So don't go away. We'll be right back with more of Dr. Chu. Welcome back to Empowered. I'm Elizabeth Naumovski. I'm joined by Dr. Willa Chu, dentist at the Concourse Dental Centre in Toronto. And today's focus is unique dental concerns for women, meaning a healthy mouth equals a healthy body. Today has been so educational, Dr. Chu. I want to talk about what are the causes of bad breath? What can be done to eliminate it? Because there's some people that you meet and you start talking to them and all of a sudden you need to distance yourself because it's awful.
So bad breath, I tell my patients, think of it as leaving a food in a plastic bag on the kitchen counter. After a few days, the gases from the breakdown of the food is going to smell. So one of the sources of bad breath is food left around the teeth. So if you're not cleaning your mouth every day, getting the food that you've eaten all day out of there, then it's going to stay there. And eventually it breaks down and creates sulfur compounds. There's other reasons for bad breath, though, and they're more from a medical side. It may be a sign of reflux. It may be a sign of some type of lung issue, some lung infection, because everything from down there will come out through your mouth. So some situations you need medical investigation as well. In order to get rid of bad breath, one of the areas that for us that is quite obvious is to brush and floss. Get rid of the food, get rid of the plaque, clean everything up especially before you go to sleep, because when you're sleeping, your saliva goes down. So there's no clearance of food, you're not drinking, you're not doing anything as you're sleeping. So if you're leaving food all night in your mouth, it's just going to dissolve and become stinky when you wake up. So hence morning breath. The other thing is when you're flossing is you're moving the bacteria around so it can't get a home. So I tell my patients, if bacteria can't get a home, it's not going to send out evites and invite all their friends and have a big party and become this big, massive moving plaque, then they won't get a chance to create the acid, create the gases that will cause a lot of bad breath. So from the dental perspective, getting rid of plaque is really important. Brushing your mouth, every day and cleaning after meals even is really important. But from the medical side, you need to also see your doctor to see if there's other medical conditions that require investigation.
So I want to talk about, there's so many people that say, oh, if I lose a tooth or whatever, it's fine. But it's not fine because once you lose it, it's not going to grow back. So why are healthy teeth and gums so important to us?
I think the first thing we have to remember is inflammation in your body causes a lot of problems. So mouth bacteria, if there's a lot of plaque around, the medical community has found that a lot of the bacteria in the mouth have now been located in your heart, your lungs, your brain, in your intestines, et cetera, causing inflammation or infections in those areas. So some things that are linked to the mouth is cardiovascular disease. They've now started to link Alzheimer's to bacteria in the mouth. They've linked low birth weight preterm babies to increased gum disease in women. Some cancers have effects in the mouth as well. Diabetes is strongly related to the mouth. So it's not just isolating the mouth. The mouth is part of the body. So what happens in your mouth happens in your body. And I think that's really important for people to understand is that the mouth is connected to the body. So if you don't clean your mouth, you don't just get rid of the plaque, then yes, not only will you have isolated conditions in your mouth, but you're also creating many problems throughout the body. So losing a tooth for a lot of people is like, oh, we get dentures. And I'm surprised that 20-year-old patients will tell me nowadays that, oh, when do I lose a tooth? And I can look at them, I go, well, that's actually insulting to your dentist, because I don't think you should lose a tooth because you're coming in for, cleanings and everything. Losing teeth makes chewing very difficult. I have some young patients, because of various reasons, that did lose their teeth, and they're functioning with dentures because they can't afford implants. And if you ask them, dentures are absolutely no fun. So, losing teeth creates issues that you can't digest your food as a senior, so that you can't absorb nutrients when you're older. So be nice to your future self and really take care of your mouth.
I think that's really important. We have 10 seconds left. I want to talk about tooth whitening. Is it good? Does it damage your teeth?
The UT put out a study a couple of years ago that said it actually damages teeth. So they did a scientific research study and it came out. Tooth whitening is very media pressed. Tooth whitening material is actually created first and foremost for therapy. It wasn't created to whiten teeth, but somebody saw it as a side effect and started to market it.
Thank you.
You have to be careful. As you get older, teeth don't get whiter. So
Great.
there's a lot of sensitivity there. So just be careful. Talk to your dentist first.
Dr. Chu, thank you so much. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. Thanks for watching. Bye for now.